Hi everyone, my name is Ryan Farnworth. I'm from Tutorial 2, and today I'll be talking to you about domestic abuse in relation to this week's subject, which is gender and crime. Uh, I will present my presentation as well as I'm going to mention a video that I will post on Canvas. So when it comes to discussion questions, you'll be referencing that video itself. Awesome, so let's get going. Okay, so to begin, I'd like to address two quotes. The first from our textbook being Boyd's chapter 10, page 230, which states the following. Violence against women has been identified as a major public health and human rights issue, and as a crime that has reached epidemic proportions in many societies. As well as a quote from the article which we'll be discussing today, which states, the United Nations has called violence against women and girls a shadow pandemic as the COVID-19 crisis fuels isolation and tensions caused by concerns over health, safety, and financial security. So the article that I've chosen to discuss in relation to this week's topics is titled Back to Square One, Calls to Domestic Violence Lines Jump Again as Coronavirus Surges, which is written by Brenna Owen and published on October 15th of 2020. So the article really struck me as it demonstrates how difficult it is for victims of domestic abuse to find help and how the current pandemic, which affects us all, has worsened these conditions. So the article is composed of several mixed medias, including comments and concerns from directors of women's shelters across the country. The article expresses the impacts of COVID-19 and social isolation on victims of domestic abuse from the period of quarantine to now and our current social distance measures. As many of these officials have expressed during the first period of the pandemic response measures, many women's shelters experienced a drop in phone-in reports of domestic abuse cases. So while this may seem like a good thing, these officials explained that domestic violence is a permanent feature in our society and that the lack of phone reporting suggests that victims' ability to self-report their abuse was stifled by the constant presence of their abusers during quarantine. So family members of victims also had less to no physical contact with victims and therefore could not witness any signs of abuse. And any contact with the victim would have probably been through Zoom or anything like that, which is patrolled by their abusers. So certain police departments have expressed that while the number of reportings have gone down, that the level of severity of the reported cases have gone up. Although the article leaves out any figures of femicide, it is noted that cases of domestic abuse will continue to escalate if this situation is not handled. It is also suggested that women are most likely to be killed in their home rather than anywhere public. Isolation is often used as a technique of domestic violence and has been aggravated by the current global pandemic, especially in the first few weeks of quarantine. As social isolation policies have lifted slightly, the levels of phone-in reporting have begun to outreach previous reportings. Angela McDougall, the executive director of Battered Women's Support Services here in Vancouver, can be quoted as saying, in BC, the Battered Women's Crisis Line received more than 1,800 calls in March, doubling the number of calls received for the same month a year earlier. The self-reporting including these surges also transpires during the periods which the victim's abusers temporarily leave the premises, which demonstrates how dangerous reporting is for victims. So these shelters for which these officials represent have struggled expressing availability to these victims, but nonetheless are using measures such as social media to inform family and friends of potential signs of domestic abuse through the pandemic's lens, as well as the contact methods for victims to reach out. So two factors that I found the most compelling from this article are the effects of isolation on the ability to recognize cases of domestic abuse, as well as the effect of finances and how they impact domestic abuse in the case of COVID-19. So public outreach is defines the level of cases that we account for. When social isolation and quarantine first became mandatory, we saw lack of reporting based partly on outsiders' ability to witness or suspect cases of domestic abuse. As we've seen in previous chapters, more specifically chapter 2, in the earlier weeks of the course, the majority, being 95% of reported crimes, are from civilians rather than police officers finding cases. So if we remove the variable of outside witnesses, the reporting of domestic abuse cases plummet. Colleen Varco, a nursing professor of UBC and a violence researcher, describes the phenomenon in the article and is quoted as saying, It's well established that incidents of domestic and sexual violence are underreported to police, and a lack of data has contributed to a gross underestimate of the prevalence of gender-based violence in Canada. And according to, once again, our textbook, chapter 10, page 230, studies identify additional risk of intimate partner violence, including living in cohabitation. So we also know that self-reporting makes up a large portion of abuse cases and abuse reportings. In the cases of for example, victim surveys, many cases of abuse and domestic abuse will go undetected by officials based on factors such as having the abuser live in the same residence. So while domestic abuse can in our regular society go unreported, COVID-19 has stressed these factors completely. So if we examine one of the quotes that I mentioned in the beginning of the presentation, the United Nations has called violence against women and girls a shadow pandemic as the COVID-19 crisis fuels social isolation and tensions caused by concerns over health, safety, and financial security. We can see that the United Nations attributed to the rise in domestic abuse to financial security issues, but as Macmillan and Gardner have suggested, the measures of socioeconomic resources, such as personal and household income, have little impact on the risk of spousal abuse. However, the symbolic aspects of who has the employment in the household are important. So when women hold jobs and their male partners are unemployed, the risk of spousal violence is greater. So I actually could not find any statistical or quantitative data suggesting that financial effects of COVID-19 can be strictly correlated with the rise in reported domestic abuse. So while that idea does not seem to be consistent in the Canadian experience of domestic abuse and of COVID, other pertinent factors are highlighted within this article, such as, although there have been lifts on social distance measures, the COVID-19 pandemic has hindered areas such as public transit, which can demonstrate how difficult it can be for victims to leave their residence in pursuit of shelters and aid. Distance and the ability to transport oneself is in itself a huge impact on these victims, especially if they maintain any financial or transportation dependence on their partner. So we also have to keep in mind that if anybody lives in rural areas, that makes the ability to find these shelters like even less. So all these factors that are impacted by how we transport within COVID-19 really hinder these women in these cases. So the article's title, Back to Square One, reflects the difficulty these officials are having to create a line of contact with victims. And as we continue to redefine and possibly re-limit social contact as the pandemic carries on, the progress officials have made to reach victims is jeopardized. So the issues that plague domestic abuse victims are relentless and are extremely agitated by the conditions of global pandemic, which we see today. So as I mentioned before, I have linked a video. It's an outside video from this article for our discussion questions. And the video is distributed by the Canadian Women's Foundation. And it demonstrates how these organizations have come up with gestures for individuals to use during Zoom-style meetings to signal to anybody that they're in contact with that they're in these situations. And this is part of the video. These are the signals that they've given. And so then the two questions that I'd like us to discuss is, number one, other than the hand gestures, which are meant to be implemented during the Zoom style calls, can you think of any other way for women in social isolation to clearly and effectively signal for external help? And number two, during quarantine, especially, many media outlets and commercial brands release commercials intending to bring awareness to issues such as mental health during social isolation. Beyond the video that I've attached, were there any examples of domestic abuse hotlines or outlets targeting domestic violence that you can recall seeing? Personally speaking, I saw this one commercial. It really has stuck with me, but other than that, I don't remember seeing any lines of contact. And yeah. So that is my presentation. Thank you so much for listening, and I hope you have a good week.